Hello, so today is going to be our TCA or our Cool Peel demo and explanation. So if you're watching this, it'll be only for private content, it won't be for public. So it is going to be if you are already being prescribed this from me, or if you have got it and need more instruction on how to use it to get better results. So let's just go through a little bit of info on Cool Peel technology. So peeling has been around for a very long time, and it's taken many decades to figure out how to do it safely. Even when I started in medical beauty, it was not safe at all. I used to perform treatments on the skin where I had no control on how quick that acid would penetrate, and it would cause negative stress. But great news, for a long time now, Environ has patented new technology that's very safe yet very effective. So I'm going to talk about Cool Peel technology. So when you hear the Cool Peel, know that it's patented by Environ. So it is literally this special technology that is going to create amazing results and very, very, very safe for the skin. And that's what we want. Growing up in a country called Australia that has a lot of light, and now living in generations that we spend a lot of time on artificial light, we do not want to be causing anything that's going to make our skin sensitive. We want to make it stronger and younger. So what is Cool Peel technology? So I'm going to be talking a lot about, I'm going to perform this for you. So it's a tretinoic acid, so TCA for short. It's one of my favorites. So why? Because TCA is actually made in a lab. So because it's made in the lab, it's less irritating to the skin. So when we're using, I have options of lactic and glycolic and many other acids to use, but this is my favorite because I find it so safe. There's just no irritation to the skin, and we can use it to correct acne, age lines, milia, cerconomas, anything that is stuck in the skin and needs the skin to be regenerated. And even more importantly, we can use it as an antagonist to stimulate new collagen and elastin. Yes. So that's why when I do medical needling, I combine this therapy within the 2-hour treatment because it works marvelously to stimulate new collagen and elastin. It's kind of like rocket fuel when you're combining it with platelet release. So if you're performing this at home, how would you do it? So if you're watching this, already know a bit about it because I've probably been talking about it with you. So TCA is something I do in the clinic, but for some clients who need more, I teach them how to do a more gentle method at home. And this is how you do it. So you would have cleaned the skin as we teach. So you do the pre-cleanse and clay, leave it on for a minute to an hour, and then wash that off with your cleanser so the skin is prepped. So my skin is clear at the moment. And it could do with a TCA because I've got a little bit of a hormonal breakout on my nose, and the skin, I've been regenerating. So I just want to push up the damaged cells to remove some of that dead skin on top. So, and I want to thicken the skin. It's been summer, so I've got a little bit of pigmentation slightly come up that I want to clear off. I've got a little bit of old scarring that I want to rejuvenate off, and I want to work on tightening as I'm getting older. Yeah, I also want my products to have more penetration. So these are all reasons why I would do it. So I've cleaned my skin. I'm going to take my roller. Our roller, we know it's not about pressure, it's about stretch. So you can see how I'm stretching my skin here, and I'm going to be creating lots and lots and lots of micro holes. So if you've got acne and the acne is active, you don't want to be rolling it. Simple, right? But if you don't have acne and you're working on any of the other problems, you want to be rolling it. Why don't you want to be rolling acne? Because acne obviously has got a legion of pus in the hair follicle, and you don't want to be putting pressure on that to explode it down in the hair follicle. You would be just literally applying the TCA straight to the lesion. TCA will gently penetrate the skin. The Cool Peel technology has wrapped the active ingredient in there, so it will safely penetrate with less to no irritation. And then the active ingredient can be released where the skin can use it, and it can correct, disinfect, sterilize that acne. for people who want to get tighter and younger, or have milias, or they have things like scar tissue and they're wanting to speed up the rate the cells are dividing. What is that doing? Well, it's an antagonist. So think of lifting weights in a gym. You need to stress the muscle in a controlled way, and then, and only then, will the body release a wound healing cycle where it will rebuild younger and stronger. That's the key. Now, if you're only having treatments a month apart, that wound healing has a cycle. So it's just a little long when you've got problems. You need to go in there close. And this is the point of having the opportunity to do some work between appointments, is that if you can't see me, and sometimes people, they just need more between sessions, you know. So this is where I want to teach you how to do this. For some people, this is going to change their lives. So once you've created lots and lots of micro channels, we'll be ready to apply the TCA Cool Peel. And I want these expression lines to stay nice and gentle and not grow any roots of deep lines. So you can see I'm really getting those holes built into that area. Some people get shocked that you do the whole eye. Yes, you do. The eye is very thin and you do not want it to get any thinner naturally. You want to thicken it and tighten it, because as we age, that skin is getting looser because our bones are shrinking, and you want to help that skin stay nice and tight on that area. So once you feel like I've done a good roll, normally I would do 4 minutes. All right, pack your roller away, pull out your TCA Cool Peel. The thicker you apply the treatment, so I've got a little bowl of water here and my Cool Peel brush. The thicker you apply the treatment, it's going to penetrate deeper. So where you have bigger problems, that's where you're going to work. You can layer. I like to do a water activation. When you keep the treatment moist, it helps with penetration. So if I just was very cautious, I'd do a thin layer and I would apply my skincare and I'd go to sleep. And I would just wait for tomorrow to see feedback. If my skin looks fine, my next treatment, depending how I'm spacing it, and that will be personalized as advice from me, I'll be telling you individually how you want to space it, then I might go thicker. For me, I'm very confident with this. My skin is very hydrated. My barrier is great. I've got lots of vitamin A in there. I can push. Yeah. So what I'm doing by pushing here, I'm doing a water activation. So I'm just dipping my brush in the water and I'm reactivating it. Now, if I had some key areas like acne, I'd go very thick on that acne. I'd do quite a thick layer. And that would really help control and sterilize the acne. Remember, the next day is going to give us feedback on what you did right or what you did wrong. You can't do harm. Feedback could be flaking skin the next day, could be tired looking skin. We're trying to remove damaged cells, so, you know, within reason of what you're trying to reduce. Some people need to do this twice a week, sorry. The wound healing cycle, just like lifting weights, if you only did weights once a month, do you expect to have really amazing muscles? No. So that's why this is more a stimulus, an antagonist to grow the factory that makes collagen and elastin. That's why it helps so much with fine lines, wrinkles, dehydration. It actually stimulates the whole top 5 layers of the skin to thicken and hydrate. So it's actually reversing the thinning and aging of the skin. And because it's, this one in particular, it's just not irritating on a healthy skin. So if the skin's well prepped, you're going to really love it. So once that's done, I could let that dry and then apply my skincare. Or step 2, I might want to go stronger. And what I'm going to do for that stronger option, I'm going to take some cling wrap and I'm going to activate it. See here, no air bubbles. and then I'll activate the bottom and I'll leave that on for 15-20 minutes. I'm going to do some computer work now, so I'm going to leave that on. So I'm going to wrap the bottom and then work away on my computer, take that off, and then I'm going to apply my skincare. Any questions, please leave below. But at the end of the day, the only way you're going to know if you need to do more is you're going to have to wait for feedback the next morning. So the skin will tell you. Usually for me, I'll look a little tighter and I'm not going to get much peeling because my skin's so hydrated at the moment. The barrier is so happy. But if those weren't happening, I could. I want to drink a bit more water internally and keep my diet very whole food, plant-based, so I'm getting all that lovely antioxidants from the inside out as well. Okay, that's a little bit about TCA and how you would do a cool peel. Bye.